Hey guys, it's Dr. James Kennedy, East Texas Foot and Ankle Centers. You know, in my office we have lots of instruments, and for me, I really feel like the more a person knows, the less apprehensive they are on going to a doctor's office. And I try to explain everything the best I can, but sometimes it's better to sit down with a couple of diagrams and a couple of pieces of my equipment and show people what I have to detect some problems. So this machine is actually called a Doppler. Okay, this machine actually detects blood flow in a hand, a foot. If there's a different type of probe on it, you can actually detect a fetal heartbeat. My wife is a maternity nurse, and she actually uses these to detect a fetal heartbeat. But today what I'm going to do, I'm going to show you how this thing works. So if you're looking at the human body and we're looking at the circulatory system, this is the heart, and the tubes that are red, they carry blood all the way down to the feet, and then the blue carries it back up. The red carries the oxygenated blood. The blue structures called veins actually move deoxygenated blood back up to the heart. So, you know, as we mature in age, lots of times these blood vessels right here become clogged. This one is for a normal healthy person. Then we go along and then they start to collect a little bit of plaque inside, and then they start to become clogged just like this, and sometimes they can develop even a clot on the inside. So what we do, we try to look at blood flow issues, and one of the ways we do that is actually to show a Doppler. And one way you can look at a person's foot and detect if they have lack of blood flow is we have arteries going down to the foot. Now there's three main arteries that go down to the foot. One of them one of the arteries is what we call the dorsalis pedis artery. We'll have the peroneal artery, and then we'll have the posterior tibial artery. So if you see these arteries, these three arteries coming down, this one goes this way, this one is more internal, and then this one right here, if you see this artery in the back coming down here, that's the posterior tibial artery. So when you put this Doppler and turn it on, you'll actually detect a blood flow to that. You'll hear this, and you'll hear what we call a triphasic pulse. You can put one right here and you'll hear another pulse. So when one of them is blocked, you won't get any type of sound at all here, but usually you should hear a what we call a triphasic sound. It'll be three sounds. So I'm going to show this to you right now, and I'm going to put a little bit of ultrasound gel on my wrist, and there's the ulnar artery and the radial artery, and I'm going to show you what they sound like, and if there's a sound, that means that I'm alive. Okay, so you put this right here, then you have this, and there's a sound that comes out of it, and you put this right here. So that's a very healthy sound. Okay, so that's a triphasic pulse. You'll hear three sounds in there, and normal is either tri or bi. But if you hear this, if you hear a sound that's like, that's not good. That means that your arteries are what we call stenosis, or a little bit plugged, and you can develop a clot or stenosis or a plaque buildup inside there. But you know, if I'm going to take out an ingrown toenail or check a person with their wound and their blood flow, I use these, and I have one in every room. They're pretty expensive machines. They're about $1,000 a piece, but I think they're worth it. The way I look at it is, if I have a person with an ingrown toenail and I don't think they're going to heal well, lots of times I'll put this on them, make sure to check them out, and make sure that I can actually remove the ingrown toenail, because this person's going to have a wound on there over the next couple of weeks. I don't want to make sure that it heals. Okay, so this is actually called a vascular Doppler. Thanks guys, see you later, bye-bye.